to this special webinar that was being hosted by Lipoedema UK. I am Shari Fetzer, Chair of Lipoedema UK, and this is my co-trustee and co-host this evening, Kate Forster. So I'd like to tell you just a little bit about why I'm here this evening and what we're going to cover. So I've been involved with Lipoedema UK for the last 10 years and chair for about 8 of those time. And throughout it all, my passion has been to change life for the next generation. And I hope that this particular webinar will reassure parents, and we've had lots and lots of parents and families contact us over the years, that their daughter's future can be different from previous generations. We don't yet have all the answers we need, but we want to reassure everybody that a diagnosis can be a step to a different life and make such a difference for a young person. And these days, we do have a lot of the information and knowledge we need to get a diagnosis for most young women once we get the information out there. There's still a huge job to do. We're nowhere near the end of it, but I'm so thrilled that we have these 2 wonderful young women this evening, and Kate, my co-host, who's also an inspiration to me and many people, to share their experiences. So Kate, I've had the privilege of sharing some of Kate Forster's journey with lipedema while working with her as a fellow trustee of Lipoedema UK. And Kate's not had an easy time as a child of a mother with advanced lipedema, but she has fought hard for a better future for herself and everyone else with lipedema in a very inspirational way. So thank you, Kate, for working with us, and hopefully we'll have time for your story and another webinar fairly soon. So Kate will be co-hosting presenting with me during the Q&A session, and at the end of which we're going to hold at the end of the 3 presentations. So it's only 2 minutes past. Do you think we have lots of people listening? Are we ready, Kate? Do you think to go live with Georgina's presentation?
Yeah, I think we are good, and it would be lovely to hear from Georgina because she's got a really great story to kick us off tonight.
Exactly. And I've known Georgina and her exceptional family. Hi, Georgina. Since 2016, I'm pretty certain. That's when you first came into my life, wasn't it?
Yes.
And yeah, with you and your mum. And I can honestly say that getting to know Georgina, her mother, and her sister, and experiencing the journey of a mother and 2 daughters simultaneously being diagnosed by our wonderful St George's Hospital here in the UK, and the ever inspirational Dr. Christiana Gordon, who I believe was the one who diagnosed you, wasn't it? Yeah. Right. Has often been the motivation fueling my passion to continue raising awareness of lipedema, and to continue seeking the best information for all our members and all the research projects and expertise we so desperately need. So Georgina was a schoolgirl when I first met you, Georgina, weren't you?
I was.
And it's a joy to see her mature into a confident and focused young lady. So thank you, Georgina, for doing this presentation. Now, you've decided to record yours for simplicity's sake, haven't you?
Yes, absolutely. I'm hoping the quality of the pictures will be much clearer for people at home. And also, I don't know if you've caught my dog in the background, but she will not be heard. So that's much better. So the team at Rafiki, if you don't mind sharing it, I really hope you all enjoy it. Yeah, thank you for this opportunity to hear my story. So,
over to you, Georgina, and your story.
So if you don't mind sharing it, that's perfect. Welcome. Thank you for joining and being here to listen to my patient story presentation this evening. It is so surreal to find myself presenting on a platform which hosts the presentations of some hugely inspirational, intelligent people doing remarkable things. And here I am sharing my simple, mundane life story. But I have done similar talks before and have found a lot of women find it quite emotive to hear a story that in one way or in several mirrors their own experiences, either of who they are today or the girl that they once were. I myself continue to be surprised by the connections and the similarities that I hear in stories and discussions, which I thought were a family thing. I believe when we share our stories and relate to one another like this, it is really powerful. For most of us, we've experienced isolation as a result of this condition. However, the more we connect and listen to experiences, we do create a stunning web between us as sisters, and it is this unity which will eventually end that uncertainty and the isolation that has overshadowed lives with lipedema for far too long. Last year, I shared our hopes and aspirations for legacy, a part of Lipoedema UK for our future generations. While it is still being developed, I feel it is really relevant to mention. Its premise and its goals relate to each one of our patient stories. Whether we are mothers or not, and irrespective of age, each one of us who has shown up tonight are here because ultimately we are seeking hope. We want to hear of the advances in understanding, the positive changes happening, and witness that increased recognition that we are so longing for. So while I am here tonight to just share my personal story and experience with lipedema, going through my personal album, so excuse the dodgy fashion trends, thank you for listening to one of the many stories that collectively will piece together a movement of change. So my name is Georgina. I am 23 years old, I live in the south of England, and I have lipedema. I was diagnosed in 2016, when I was 17 years old, and I believe I am one of the youngest diagnoses to have happened yet. Brilliant, yes, I feel so fortunate to have had the diagnosis when I did. I would much rather not have it, of course I would, but knowing that I do has changed my life for the better. I will go into this further later on. I have had a total of 4 operations with both sides of my body simultaneously. I've had 2 surgeries on my thighs, 1 on my lower legs, and my last was the whole arm, which I had just the previous August. I come from many generations of lipedema, with it affecting every woman in my maternal side as far as we know. And lastly, I am almost a primary school teacher. I have 1 more year until I qualify. So I am not knowledgeable in the slightest when it comes to medical stuff. So please bear this in mind for questions later on. My presentation is all very much my own opinion, just perspective and my experience. Despite being busy at university and placements, getting my career underway, lipedema is such a significant part of who I am. And while I will refuse to allow it to define me entirely, it is part of what makes me, me. And this is why, even though I sometimes like to pretend I don't have it and forget about it for a while, I'm not able to let it go. It definitely feels like my purpose to do what I can, even the smallest contribution to benefit the lipedema community for those generations to come. So, as a family, we became aware of the condition in 2017. The lovely medical photograph of myself, my sister and my mum, pictured here on the right, was spontaneously taken that exact day. I'm on the left, with legs like that at 17 years old. In the red knickers, which I didn't know these were going to be taken, so I wouldn't have gone for those if I had known. It was our first consultation with Dr. Christiana Gordon at St George's, and it was a very surreal day. Being told we had a named condition, that our legs weren't because we were greedy or fat or lazy, we had a reason for why we looked like we did. I'm sure many of you can relate that it is overwhelming to be given that diagnosis. It took a long time to process the fact and accept it. Your whole belief system of who you are is challenged that day. Of course, I was very young, but my lipedema was rather present and it had already taken so much away from the quality of my life. In perspective, however, I had come from generations of this condition, the majority of whom had died not knowing the reason the body looked the way that it did. And it's so hard to think of how many years and how many lives have been wasted and continue to be wasted in self-blame for something that is far from anybody's fault. Lipedema had dominated the lives of the women before me. It defined relationships, it often denied fun and freedom, and destroyed most self-worth and esteem. I grew up close to my mum and my nan, who were each very vocal and clear they had an issue with their arms and legs, and of course, before we knew anything about this condition, it's just what the women in our family looked like. With my nan's maiden name being Bert, it just became the renowned Bert Bottom. As TV fashion segments always were showing tips and tricks to cover up tummies, no one else seemed to want to cover up their legs, and stylish, flattering clothes for a lipedema body weren't easily accessible. I say weren't, but it isn't really that much easier today. It was a frustrating trait that we just each inherited, and we had to get really creative to find ways around. I remember being a tween and buying surf shorts, for example, and thinking, oh, these are perfect, the perfect cover-up by the beach at the pool that didn't look obvious, but it covered up my big cellulite-ridden thighs. My nan had 7 sisters, and each were affected by lipedema in different ways, some displaying with very large legs and some also with their arms affected as well. It displayed differently, but it was undeniably there in each and every one of them. My great-grandmother spent her entire life struggling with the condition, and now with an appreciation of the hormonal link, it's crushing to imagine the pressure that her body was under as it dealt with the hormonal changes of 11 full-term pregnancies, in addition to being expected to stand on your feet all day in a hot kitchen. And now this is unbearable enough to even imagine, but on top of this, the treatment she was given was hot compressed towels. My nan recalls how she was strictly told not to touch mum's legs, and this strict instruction got passed down the generations. Having witnessed how devastating lipedema has been on the quality of life of my mum and my nan and women before them, while I wish it wasn't such a stubborn chronic condition, I do feel fortunate to be the new generation of women who knows about it early on. While there is pain, it is a blessing not to be clueless to what's causing that pain and to know that there are people out there working hard to find ways to help manage and prevent that specific pain. And while I'll so often cry about how my legs look, no longer do I blame myself for the way that they are. With knowledge of it, no longer does it have to control my life or choose our careers or prevent us living. We have a valid health condition to which we deserve the right care for and compassion for ourselves. These are the women, our grandmothers, mums, great aunts, great grandmothers, that we have to be brave and to get our voices and our stories out there in honour of. Because I know how valuable an early diagnosis is, and that knowledge and understanding of what our bodies needs in allowing for a better quality of life. Either we just stay victim to it and pretend we don't have it, or we just be brave, we embrace it, and we do something to improve what a life of lipedema can be like for the next generation. So through my teacher training, I have learnt a lot about how our childhood shapes the rest of our lives. These years are when beliefs are formed about who we are, how much we are worth, and what we can become later on in life. In my early childhood, I was slim and energetic. I mostly wore miniskirts and loved prancing around in them. I sometimes think this was me subconsciously enjoying the legs while they lasted. When I had surgery, I felt like my most authentic self, the girl who felt free doing twirls in a miniskirt and enjoying her summers in comfy shorts, carefree. I will come back to me post-surgery later though, because it isn't this straightforward. At family occasions, the topic of diet and weight would always come up, often in the form of comments such as, a moment on your lips, a lifetime on your hips. It makes me cringe thinking of this. But I also remember overhearing a discussion about weight and commenting that I have no idea what I weigh, only to be told, "Oh, soon enough you will." Reflecting on these early years, I can see how while my body was not yet displaying any sign of lipedema, my mind was constructing the belief that I would have a body like the women in my family one day, and I will also have struggles with my weight. Now, I'm definitely not saying it's a belief system that's given me this body. Of course not. There is far, far more to it than that. I'm just simply reflecting on how I accepted it as a fact. I accepted that this is how my family looked, and unfortunately, I'm also going to have to spend my life on a strict diet and searching for outfits to disguise my legs. It wasn't long until my legs started to morph from little twigs into the classic tree trunk shape. I thought that lipedema appeared at puberty when I was aged 9, but in the photographs I can see that thick legs began to show from around age 7. I recall sitting in PE looking at my legs compared to the girls in my class. How come they don't have rolls on their thighs? And why can't I see my knees like they can? But still, as you can see, up until I entered tween years, they weren't bad enough for me to cover up. And I'm so happy that it didn't. It was much more of a personal battle and all very confusing. Having been a slim child, suddenly why can't I wear shorts that don't rise up with each step? How come I can't fit into the Miss 60 skinny school trousers that all my friends have? And why am I very quickly outgrowing the trousers, the skirts and the shorts available in the children's clothing ranges? My mum recalls being told at a similar age that this could just be puppy fat, and so I think this was the continued subliminal narrative of hope that we all clung on to. However, as one would expect, lipedema did start to pick up pace as I began to enter the dreaded teenage years. These photos here were taken at friends' 12th birthday parties, and how brilliant was it that tights and leggings with shorts were in fashion and accepted as party wear. They were probably 2 of the only trends throughout my teen years that worked with my legs. The picture on the left is fab camouflage, but you can see my thicker ankles and calves beginning to take shape. The picture on the right, however, a couple of months later as we entered summer, was not so well camouflaged. I was thrilled to have thick black leggings hiding the worst of the cellulite on my thighs, and at age 12, how sad is that? But you can see my calves really showing that lipedemic deformity just below the knee. It was hot, we'd walked a lot after school, my legs would get swollen. It was embarrassing, but ultimately really sad. I was mortified when seeing this picture on Facebook, and I just wanted it eliminated from existence. Since when did I suddenly become a big girl? Like, why are my legs like that? And how come I could literally fit 2 of their legs into one of my chunky ones? This didn't look like me, and my first thought was that I must go on a crash diet ASAP. My belief system came into action, and I was suddenly no longer free to wear, to eat, or to do as I really, truly wished. As a teen, my legs grew and grew, and tests in recent years have shown me how weak my poor lymph system is. So I would swell and swell on top of my already large and heavy legs. But, as you can see, I became very clever at covering up my legs, and I mastered the art of photographs. So much so I couldn't find any of my legs during these years. They will be somewhere, but I've even done a very good job at hiding them. Whether it be asking to take a picture from the waist up, standing behind people or objects, perfecting that lean-in pose, ensuring my legs were as cropped out as possible, or making up a convincing excuse, such as, I do prefer to wear the long skirt actually, when really, I wish I could wear a cute short one. Or, oh no, I don't feel the heat, as I stand there sweating, wearing thick black jeans and long sleeve tops all summer again. I had a very slim upper body throughout my teen years, but this was maintained through an extreme and unhealthy relationship with food. Atkins, Dukan, juice cleanses are but a few crash diets that featured in my life at this time. I was obsessive over what I ate, and this makes me really sad. When writing this presentation, thinking of how to structure my life experience neatly into 30 minutes, I thought about whether it would be appropriate to touch on how lipedema had screwed up my relationship with food and played a role in giving me an eating disorder. But that label feels almost shocking, and it is something that my mum and my sister also find hard to face. These unhealthy eating behaviours became so normal and so accepted. Were they really that damaging? Are we really disordered? The sad thing is, as part of my story, it has been. The years spent fighting my body, not knowing why it wouldn't do as it should, meant I was fighting a losing battle and hating my body. The amount of lost memories over a meal or a celebration because I was always on a diet. I even ate hardly anything but chicken breast for an entire week and a half before prom to try and look as skinny as possible. I was constantly fighting my body. I did not feel like myself. I'd stopped having fun with my clothes in exchange for the best camouflage. I would fight hunger for days but see no change in my legs, and this would just trigger a binge response. My poor body was not loved, it was not given the compassion it needed, and I was just in denial to accept that this was my body. I know I won't be alone in this having scarred me hugely, and today, at the age of 23, I'm left battling many eating disorder habits and body dysmorphia, which I believe to be a fault of this condition. I mean, this is such a deep and sensitive topic, which requires its own presentation, but it is something I know I'm not alone with, and something that I really hope Legacy will play a part in preventing and nurturing and supporting other young women through. So I was diagnosed age 17 in the November, and these photos were taken this following summer. Gathering these photos together, it is clear to me the difference that a diagnosis had made. I mean, for one, look at how many different scenarios I had my legs in the photo. I had validity of a medical condition that wasn't my fault. I knew what no women in my family had known before, that our legs and our arms aren't our fault. We aren't just fat, we aren't imagining this, and we aren't the only ones with a body like this. Although my disordered eating continued, the obsession didn't dominate my life so much. I understood what I was working with, and I felt hope. I felt hopeful that treatment will be the final push for my legs to transform into what they should, and what they should have done for my dieting. While it took me ages to tell my friends, in fear that they would judge me and assume it's another one of my quick fix finds on the internet, when I had the courage to tell my closest friends, I suddenly felt a huge weight lifted. While I can see a shift in my acceptance and ownership of my body, of course, this year pictured was not all smiles and proud poses. It was a shock. I felt a huge relief that I had a condition to explain why my legs were like they are, but with the majority of women then being diagnosed later in life, I was left feeling very isolated and a bit bleak about what the future would look like for me. I was given a thick pair of compression tights that I had to wear every day. I felt so embarrassed telling my friend about these gross granny tights that I had to wear for the rest of my life. And I still remember struggling getting the words out to tell them. Between these images and images before, I have cried countless hours because of my body. Feeling that it is so sad, I still can't wear short dresses and cute shorts without feeling like the whole world is staring and judging. And how come the only way out of this is surgery? This was a cookie we had made for my mum after her first lipedema liposuction. Little did we know it would not be that simple. So I have been fortunate to have received a total of 4 surgeries, and hopefully this is all I will need. Again, this is 2 upper leg, 1 lower leg and 1 whole arms. All were taken place in Germany at their Hansa clinic. I was reassured as they are one of the leading clinics with a lot of experience. But surgery is not an easy escape card, as much as I thought and hoped it would be. It is intense, and for a girl who didn't like blood very much, I had to very quickly get over that. Your entire body goes through a lot, and the aftercare certainly isn't to be overlooked. While the surgery briefly gave me legs like this, of course the body adjusts, and so my legs are more like this now. They are going to have a texture that show up in unflattering light. They wobble, I still have those hidden chunky knees, and they are still covered in cellulite from top to bottom. But you know, I've got to a point now where I think, who cares? I have had so much lipedema fat removed that my legs don't hurt so much. Yes, they still swell and they are tender at times, but I have to respect that. I'm now at a point following treatment where I do my best to live a healthy life, and part of that is understanding that I need to respect my lymph system. I need to take care of my legs. I need to eat healthily to make my surgeries worthwhile. It's a very, very long journey of learning about your body, what it likes and what it doesn't, and what it needs. It constantly evolves, but you know, you figure it out. You figure out your body as it changes. Ultimately, I am aware of non-surgical treatments such as MLD and compressions that I can turn to when I feel like I need a bit of extra support. If I see my legs in pictures like this, you know, I feel grateful. They look so much better than they did. I've had the painful tissue taken out, and I feel grateful that they hold me up, they get me places, and they allow me to live my life. So this brings me to who I am today. I've gained weight, I've evolved, but I'm so much more comfortable in myself. My hopes and aims for the future, for myself and for every woman, is to respect our bodies. I want, you know, to manage our legs by doing what helps them, but not to the extreme, to the point where it becomes obsessive. We are so much more than our legs, and life is a whole lot better when you start to look up. And this brings me to my next point. I'm pursuing a career which requires a lot of crouching down, sitting on legs and walking around. Without understanding of the condition, not knowing to wear compressions on days with a lot of standing, or by sitting on my legs even if it hurts just because every other teacher can, I could cause myself a lot of damage. But as I know about it, you know, nobody should be held back living their life how they want. Finding these adaptations to enable us to pursue our choice of careers that allow us to travel comfortably, to have children without fear of what if they have it, and to enjoy food and drink. Of course, with a healthy balance, no one should have to live life entirely dominated by lipedema. Find a healthy balance and stick to what works for you. P.S. It doesn't work for you if you don't enjoy it. You know, ultimately, I want everyone to recognise lipedema, to see that shape and instantly know it's not their fault. If I ever have daughters, I don't want them to feel limited in the world should they inherit it. I want every opportunity available to them, as I'm sure all of you will do too. This is why I, as an introvert, stand and I do speeches, I have my photograph taken in compressions, and I share my personal, very personal story. It's because we need to understand how it affects us personally in order to take action in changing this movement of change.
And so I thank you hugely for the role that you are taking.
Thank you all so much for listening to my story this evening.
Thank you, Georgina. That is truly inspirational. You express things so well, and you take us through your journey. I'm speechless, really. I've heard it before, but it gets me every time. And I know so many people understand what's happened, but it is so exciting that you are coming out the other end with such positivity and a career. I mean, over my time with Lipoedema UK and all these surveys we've done, I've literally heard testimonials on the story of several thousand women. And so many of them start off like you do, trying everything, but just hitting a brick wall and living with uncertainty and a crippling quality of life that prevents them having a rewarding career and often, you know, enjoying their family life. So thank goodness it's not going to happen to you. That's the best thing.
There is.
Yeah.
So, yeah, thank you very much.
Well, that was great. And thank you for recording it for us. We're going to move on to Margarida now. Margarida, are you there? Would you like to switch on your camera, please?
Can you
Hi.
see me?
Hello. Hi there. Hi there in Portugal.
Yeah.
Yeah. So as I say, sorry, did somebody say something?
I did no.
No. Okay. As I say, you know, I've heard lots and lots of people's story, and I've only recently met Margarida, but already I loved you because you came with such a great attitude. And, you know, I felt you and Georgina have so many similarities, but differences that it's important to listen to both of you. So Margarida is 26 years old. She has a master's degree in pharmaceutical sciences, and I do think that is absolutely brilliant. So congratulations on your great career choice.
Thank you.
And you are working as a hospital pharmacist from 2009, exactly the same time as you were diagnosed.
Yeah.
So your passion is getting this lipedema known to society through your blog. I think that's what you're doing. Yes.
Yeah. It's a way of making it. Yeah.
Yes, that's brilliant. Okay, so I'm going to hand over to you to do your presentation.
Okay.
See you later.
Yeah, thank you. I will ask Rafiki to put on my slides, please. Thank you so much. So, hi everyone. I'll be talking a little about my personal experience living with lipedema. But first of all, I would really like to thank the invitation to speak today, because for me, it's a great honor. And it's actually the first time I'm talking about this, so it's kind of emotional for me, but in a good way. It's awesome. So thank you. I decided to begin with this picture because it's actually one of the few that I have wearing a bikini. And it's very visible that I have lipedema not only in the bottom half of my body, but also in the upper half in my arms. And you can also see there a tattoo of a sunflower that actually represents for me that beauty can be different, because in fact this flower is very different from the others, but it's still beautiful in its own way. And that's a message that I want to portray also. And so I would like to start with a timeline and say that my body acceptance journey started long before I was diagnosed with lipedema. I was in fact a normal child. I was very skinny. But during my pre-adolescence, I started to notice my body was different from the other girls my age. And so it began my struggle and my self-esteem issues that I had to work later on. During my academic years, things got more difficult, and finally came the diagnosis of lipedema. I began to accept this disease in my life, and later had a mindset change about it that remains until today. So during my preteen times, I always knew I was different, even though my legs were still very skinny at that time, and they were until I was around 16 years old. I could always see the difference. For example, I never could wear a high boot, like never, because my legs just didn't make it. That zone, that bottom part of my legs, were always very complicated to deal with. Also, they had a different color from the rest of my body, and I always had very dry skin. And I hadn't been diagnosed yet, but I still struggled to accept my body as it was. And I think, in a way, this kind of helped me later on, because in fact I started my body acceptance process sooner than other people that are diagnosed pretty late in their lives. But still, it wasn't easy and really affected my self-esteem as a young teenager. When I entered college in 2014, things got more difficult, and my legs were already fat at that time. And for some reason, I insisted on wearing skinny jeans that didn't flatter my body at all, and actually caused me more pain. Besides that, in Portugal, we have this tradition where we use a specific black suit for special academic moments and activities. And that skirt still haunts me today. Because, as you can see, I have all my body covered except for the lower half of my legs. That's the part that I hate the most, because I can deal with my hips, but that part of the legs was always an issue. And so to see myself in such meaningful moments with my body looking its worst made me sad, and it still kind of does today, to be honest, because it kind of damaged those moments. I don't regret wearing it at all, because it has a lot of meaning to me, but I struggled. In fact, I always had a hard time with clothes, to be honest. I could never find something that fitted well, because truly I have a body dysmorphia, like I'm very skinny on top and with large legs at the bottom. And it has always been a process that I only could get past later in life and be okay with that. So then I tried to lose weight like any other normal person, and I actually succeeded. I lost 15 pounds at that time, but that change wasn't at all visible in my legs or in my arms. So I was 22 years old at that time, and as I said, I already had some symptoms, especially pain, but I could never guess that would be associated with a disease. Like, that never crossed my mind at that time. And at the end of my degree, when I started working at a pharmacy as an intern, and that includes several hours standing, my legs had something to say about it, because I experienced all the symptoms. But the funny thing is that at that time, the one that got me to see a doctor was actually the veins, the varicose veins, because I have family members who had them and they had some complications. So I decided it was better to go and see a specialized doctor about my veins. But then imagine my surprise when, after a few examinations, he tells me I have lipedema. I didn't know what it was, and I actually asked like lymphedema, because it was the only thing I knew. But the truth was that all the questions he asked and the symptoms he described matched perfectly with my legs. He asked me about family history, but to tell you the truth, I have no idea if I have some family members with lipedema. I know my grandma and my mom don't have it, and I can only wonder about two cousins who always had very large legs, but because they are also a bit heavier, I think no one ever suspected about an underlying condition. I also done an echo Doppler at the time, and thankfully everything was fine. So then he explained me the treatments I should do, and talked about doing 11 sections of manual lymphatic drainage. That would be like the cure for my lipedema. Yeah, that didn't go well. So in the middle of all of this, I couldn't stop but wonder how I was going to afford all of this. To be honest, I was worried about it, because I was just starting my life as an adult, and I was starting my career, and I didn't know how to manage all of this. The whole thing was a terrible shock. I cried a lot that day. And on one hand, there was finally an explanation for all the differences, like I wasn't crazy, something was actually happening. My legs weren't just fat, it was something else. But on the other hand, it didn't have a cure yet, and it wasn't easy to manage. So It was a very controversial feeling at that time. And then it continued because all of these questions started to pop in my head, especially after I realized that because this disease was so recent and the cause of it was still being studied, there were a lot of different things, opinions, alternative therapies, and I felt like I was doing a trial and error method, like what does it work for me, what it doesn't. And for example, the doctor prescribed me a medicine, Vessel, that it didn't work for me because I started getting a lot of bruises more than often, because it's normal for me to get bruises, but they were very large and it didn't make sense. So I stopped the medicine. And also the clinic I started going was so very expensive, and I had to try and find other solutions that were still effective but more economic for me. Some of these questions still are very meaningful for me today. For example, I have no idea how my body will react to a pregnancy, much less 2 or 3, whatever should I have. And that's the most concerning thing for me. Also, I have tattoos both in my legs and my arms, and I still don't know to this day the effect that they will have long term. It remains a mystery to me. Because in lipedema, you have a lot of different experience, different stories, and some went well, but others not so much. I really believe that every lipedema is different, so it's normal to get these different outcomes. I feel the same way about liposuction. I know some wonderful success stories, but it is always a question of how will my body react to it, because each case is different. And that's one of the things that makes me wonder so much about all these topics. But like everything in life, there's pros and cons to every situation. I made a few accomplishments because I finally ended my battle with clothes and now feel comfortable and confident with what I choose to wear, and not only to cover. I choose to wear the things that I want to wear, not to cover my legs just because I want to wear them, simply. Another thing I'm proud of is that I could accept compression socks quite easily. I know most people think they're ugly and struggle with them, but for me, and working as a pharmacist, they are life-saving. Of course, it's not easy. I have irritated skin sometimes for wearing them. I spend a lot of time in the morning trying to put them on sometimes, but I take it one day at a time. And so, finally, this whole process has taught me to love myself and also my lipedema, because it is a part of me. So if I don't accept it, I'm not truly accepting myself, not truly. And so, of course, I still struggle sometimes. It has been a long and hard journey of acceptance and trying to figure out how to best manage my symptoms. However, in the middle of all of this, there's cons. I have not found yet any help in the healthcare system because it's still seen only as an aesthetic problem and not a chronic disease. And there's also no definite cure for lipedema yet. But I'm hopeful that the investigators will continue to uncover more and more information until they finally can find a solution to us all. And then when I felt better by myself, I felt the need to write about it, about my story and my everyday challenge being a young woman living with lipedema. Because in fact, I know people from Portugal with lipedema, but no one my age, and it's always very different. This blog, in that sense, has helped me a lot because it's a way to put my feelings and thoughts about lipedema and actually my self-image out there and my opinions. Sharing my experiences like this has been liberating, and I can honestly say that the feedback has been wonderful too. Finally, I would like to say that I still have a lot of questions, as you can see, and fears that don't have an answer yet. But I'm hopeful for the future. I try to manage my disease by focusing on it one day at a time. And finally, truly, my main goal is to find solutions to overcome the day-to-day challenge and make lipedema known to everyone. And I want to thank really everyone that has been listening to my story until now. I'm sorry for my English. It's not very good, but hopefully I could portray the right message. And thank you so much for listening to me. There.
Oh.
Hi.
Hi, Margarida. That was truly inspirational as well. And I love the way you're so analytical, and you are in such a good career to really analyze the information you have and to assess it and choose your future treatments and everything. What do you feel, Kate?
I think that, like so many of us, we hear elements in your story and in Georgina's, and I think it is so resonant. I agree with Shari. You raised some really great questions. Pregnancy is a very classic question for women with lipedema: where to go for the best contraception, how to handle the impact of pregnancy on your body. So you've got some absolutely great observations, and I think a story that's inspiring because women like yourself and Georgina are what we want to drive for. You know, the younger someone is when they get a diagnosis, the earlier in their experience of lipedema, the best help they get. And as you say, we can help give the researchers access to a research population so that they can then from there give us all better advice and better treatment. So it's been amazing to see your story. I can't wait to go follow you on socials and read more in your blog. I think it's really inspiring, and I think it's wonderful that we can work in this way to share our stories and show how experiences are similar in different countries at different times. So thank you, Margarida.
Thank you for the invitation.
Yeah, and I would just mention to people who've logged into this series of webinars for the first time, what is so important about it is international cooperation. We will only solve this by sharing our experiences, seeking out the best advisors, the best specialists. And we are very lucky because when you look around the world, there is a lot of talent and a lot of people working very hard to help patients with lipedema. And I don't actually know of any country that will do it on its own. Some countries are good at surgery, some are good at research. Here in the UK, we've got a fantastic genetic research program going on. They're all too slow. They drive us crazy because it's taking so much time, but it is really, really brilliant. Would you like to add anything, Georgina, to what's been said before from your experience?
No, I just think it was so lovely to hear Margarida's presentation. Obviously, it's similar, but there's differences, and I just think it's just hugely inspirational, and just massive well done for being so brave and sharing your story. So
yeah, your English is pretty good too.
Oh, thank you. I was nervous about that.
No, you were amazing, and I think one of the things about having people like yourself and Georgina here, Georgina touched a little bit on legacy, which is a concept that Georgina is responsible for championing in Lipoedema UK, and building that out is a real international network with people like yourself is so powerful. So I'm sure this won't be the last time we hear from the two of you together, and I really hope it isn't. So.
Brilliant.
Well done, you two.
Yeah, so I'm hoping we've got Monica now in the wings. Are you there, Monica? Can you like to log on and join us? Yeah, it worked.
Yes.
Well done. You sort of popped up like a little genie. That's brilliant. I'm really, really thrilled to introduce Monica to everybody, Monica Smith. And Monica has a great background, and she is such a wonderful example of a healthcare professional, specialist nurse getting interested in lipedema and doing her darndest to help patients and find out new and better treatments. So Monica has been in the nursing profession since, I thought it said 1983. No, 93. It says 83, Monica. That is a long time. Yeah. You are a registered general nurse, a qualified district nurse. You have a degree in clinical nursing studies, specifically tissue viability and wound care. You are a qualified lymphedema specialist, including MLD, at all levels, and a midline edema qualification, which I think is a very fascinating topic I'd love to come back to some other time. And you did manage your own lymphedema team for 8 years in Birmingham in the early days of lipedema diagnosis. And you actually saw your first lady with lipedema in 2006.
Yes.
Yes, and you've seen a lot more since then.
Oh,
I
yeah.
know.
I think that was when the penny actually dropped, and I saw this lady with distorted lower body, and I hadn't got a clue, and I was on a lymphedema course at the time, and suddenly the light bulb went on, and that was it really. I thirsted for more information right from that moment.
Yeah, we've been brilliant. I know you've popped up at all our events. Yes, to help us.
And penny.
And in 2015, you became a clinical trainer with Medi UK, who are a compression garment specialist. And obviously, we're very, very grateful to the support we've had from Medi throughout Lipoedema UK's existence, and continuing, you know, because it is great to have the expertise. You know, we don't think patients can handle this on our own. We really want this, and I think we want better products. You know what I mean? That's one of the way we've worked together about looking at existing products and hoping they can move forward and be more lipedema specific. So I'm going to hand over to you, Monica, and your presentation. And thank you very, very much for taking part this evening.
Thank you, Sherry. Thank you, Kate. So thank you very much for this opportunity, Lipoedema UK and everybody else. And thank you very much to Margarida and Georgina to share your amazing stories, actually, because it helps put a perspective to the rest of the population about what young people suffer. In my role at the moment, I tend to see the chronic side of lipedema, so I'm seeing the later stages. But this session today, really, and it's only short, you'll be glad to know, is really about talking about what compression options are available. In Medi UK, we've worked closely with Lipoedema UK and other lipedema organisations to specifically develop garments for people with lipedema, but I know there's still an awful long way to go as well. So you know about all the stages and everything, but from my perspective now as a specialist in compression therapy with a big background in lymphedema, is why is compression advised? Because compression will not take away lipedema tissue, but it will improve limb shape and streamline body contours. It will help support tissues and reduce joint pain, and it will encourage venous and lymphatic drainage. So it will help support the veins, prevent backward flow, and help get rid of any excess fluid that is impeded and impacted by the lipedema and adipose tissue. I think there's a bit more to that, actually. That doesn't seem to have flicked in. Anyway, one of the biggest problems that we have with compression garments is getting it right first time. And a lot of people, when they get their garments for the first time, if they fit it and they say it doesn't work for them or it doesn't feel comfortable, then they bin it or they stick it to the end of the cupboard or something. So we need to address those common barriers to hosiery concordance very, very early on. We need to be mindful about how important appearance is. And we've just had 2 fantastic presentations about that, you know, as you're growing through those pubescent years, how important it is as all those hormones start to surge, how you feel about yourself and how you present to other people. As we've already heard as well, application of compression hosiery isn't that easy. What can we do to help that? How can we address the pain? And how can we generally educate people, not only people who are suffering with lipedema, but also healthcare professionals, and educating those people of actually understanding what we can do to help them. And I met a very inspirational lady up in during lockdown in Scotland who just would not let go, and she got what she needed in the end because she just pushed against a closed door until she finally got her answer. So one of my biggest things that I'd like to say is never, ever, ever give up. Somebody eventually will listen to you. So how do we ensure a good fit? First of all, hosiery should always fit well and not feel loose. It should really fit like a glove. It shouldn't be twisted or rolled or folded down because that will give extra compression where it probably isn't needed. It should sit 2 fingers width below the knee crease or 4 fingers width below the buttocks. The fabric should be evenly distributed throughout the garment. It's very easy sometimes to get a stretchy garment and pull it up high, and then it's overstretched and it won't give the right level of compression to streamline and support the tissues. If numbness or pain occurs while wearing compression therapy, it is always best to try and move, get up, walk around, exercise the ankles. But if that pain or numbness or discomfort doesn't go away, then it should be removed and reported to the clinician who has prescribed the compression hosiery. It shouldn't pinch the skin or cause any discomfort at all. How do we get the right fabric for you really depends on the shape of the leg and the feel of the tissue textures, and there are two different sorts. The first one is called circular or round knit, and the second one is flat knit, which we'll come on to in a minute. So circular or round knit is a seamless garment. It's knitted with one thread on a mannequin that goes round and round and round to produce a very aesthetically pleasing, fine appearance. This is for stage 1 for lipedema, and from my own company perspective, Medi UK, these are the fabrics that we provide for such stages. In the round knit fabrics in stage 1, we provide a garment called Duomed Soft, which is very soft and stretchy and goes on and looks very sheer and aesthetically quite pleasing. We also provide Mediven Plus, which is a more robust garment. You can get it in below knee, thigh high and tights, and Mediven Elegance, which is quite an elegant garment in the same styles as well. Applying mild compression with Duomed Soft, you do need to measure. Measurement is simple. It's just around the ankle, just 2 centimeters above the ankle bone and the widest part of the calf. Because this garment is very soft and silky and stretchy, you don't need the length. So it's just very simple. If you want a thigh-high garment, you just have to measure the widest part of the thigh. And the same with the tights. It's still ankle, calf, and the top of the thigh to get those garments. It comes in 5 different sizes. Measure the ankle, measure the calf, and you get the garment that you need with the correct sizing. Mediven Elegance is a light material, slightly stronger than Duomed Soft, and it becomes in below knee, thigh and tights option, specifically designed for ladies with off-the-shelf and made-to-measure varieties available. Then there's Mediven Plus, which is a slightly more robust garment. So this is very suitable if you have got some minimal shape distortion at this stage, or if you've got some buildup of fluids such as some chronic edema or lymphedema starting to form. It's available in below knee and thigh garments, and it's off the shelf or made to measure with extra wide calf sizing as well. Again, the same measurements apply. Measure the ankle, measure the calf, measure the thigh, but you also now need to include the leg length. So measure the ankle, measure the calf, and then measure the leg length as well from the back of the heel to 2 centimeters below the fold in the knee or up to the just below the buttocks if you want thigh high or tights. Easy to prescribe, they're on prescription. All the garments that I've spoken to you about are available on prescription, and you can also self-purchase as well. If we move now on to flat knit, we're starting to look at a garment that's much more robust, and I noticed that Georgina said about having to wear gross granny tights, and I can sympathise with that because when you compare them to a round knit or a circular knit garment, they are much more robust, but hopefully I have a little solution to make them a little bit more aesthetically pleasing to the eye. So flat knit garments will accommodate any shape. So they are knitted on a flat row of knitting needles, and then they are brought together with a flat seam. So they will always have a seam running down the back of the leg. They are much firmer, and therefore they're able to more likely to streamline and contour and bridge any skin folds that are forming. And this lady up in Scotland that we fitted with a flat knit garment said she felt she was suddenly walking on air, and she was able to lift herself and bounce along because she felt so supported. So for stages 2, 3 and 4, Medi UK provide a specific garment for lipedema ladies called Mediven Cozy. This was brought into our portfolio back in 2020 during lockdown, and it was specifically designed for people with an adipose condition because it's got a high longitudinal stretch, and the stretch in it allows for great freedom of movement, so it doesn't impact on any ankle fold or skin crease. And you can see a lady there with lipedema then contained in garments. The benefits of made to measure cozy are that it's got a high wall stability, and that literally just means that it will support the tissues in a stronger way. It still looks nice. I think it looks nice to the eye. I do wear it as well. We are encouraged in our company to wear compression garments of all the ranges, so we feel comfortable and we can actually promote how it actually feels. So I do know how flat knit garments actually feel on people. It has a streamlined effect and specific areas around the knee, around any joint, particularly around the heel as well. It has a micro massaging effect to give that comfort to the tissues underneath. And it has two extra properties called climate comfort, which allows the limb to breathe. So it allows any perspiration to simply wick away. It doesn't absorb any sweat, so it can make you feel a little bit fresher in hot weather. It also got Climate Fresh in the foot of the garments, which allows an antibacterial feel to it. And so it doesn't build up with any bugs or debris and keeps the garment fresh. So basically for a made to measure garment in flat knit, we say the fuller the figure, the firmer the fabric has to be. This unique garment for lipedema can be personalized to your style and to your needs. It's guaranteed for 6 months. If anything goes wrong within that 6 months, we are a company that never quibble. All you need to do is phone the company up and say what's wrong, and we work with you very, very closely to try and get things right for you. There's a wide range of colours and patterns at no extra charge to the person who's either buying it or having to prescribe it. So there's no extra charge to the NHS. And then it has this high longitudinal stretch for high flexibility. It's a soft, flexible fabric, and you can machine wash it and tumble dry it as well. So these two ladies have had liposuction. They now sport Mediven Cozy. There are different patterns for the flat knit garments: nature, stripes, dots, or the classic, and then different colours as well. The mango yellow, avocado green, magenta, blue jeans and grey change most years within line within Vogue. And when they brought out mango yellow and avocado green, my daughter works for Speedo. And when I said, I don't really think mango yellow is a very good choice, she said, oh, forget that, mother. You know, she said, our swimwear this year is full of mango yellow. So we do really try to keep up with what is in vogue for people to keep comfortable and in that line of trend. So there are lots of fashionable colours. Because it's made to measure, you can have any style at all. And this lady, because of application problems, she's actually wearing a garment up to her thigh and then a pair of shorts over the top, so she can get them on and off a lot easier. And as you can see, it hasn't taken away the lipedema, but it has streamlined and contoured her line. Now, we spoke earlier about access to healthcare practitioners, and I do appreciate that it isn't possible for everybody to access a healthcare professional. A lot of it around it is education, and it is fantastic to see Georgina now entering primary school education, that she'll be on the lookout for people, youngsters who are developing lipedema. And also at pharmacist Margarida, you'll be able to see people who have got lipedema, and you may not be frightened you'll be more confident to actually address their needs and their concerns. It is possible to get compression without a healthcare practitioner. There are private MLD therapists around that will support with MLD, with compression. Every company, not just Medi UK, have clinical advisors in every corner of the United Kingdom. In fact, Medi have 90 countries that we are situated in, so it is worldwide. But measuring can be done with a practice nurse. If they are underconfident, they can always ask the company to provide a specialist to come in and support. And I fly all over the place to support people. We can also offer appointments by Teams as well. What we don't do, though, and what no company will do, will be able to see you without the guise of a healthcare professional. And that is because we need to have a firm diagnosis. We need to have a proper assessment, and then we have to have a review. So the person with lipedema going to compression is supported throughout the whole of their life until they're maintained and independent. So if you can be guided by your healthcare practitioner, or whether you're working independently, these are the different styles and variants that you have. Don't take no for an answer. If you want it, it is available. I can only speak for Medi UK, but these are the different styles that we want. So if you only want a portion of your leg compressed, it's possible. The only thing that we don't advise ever really is to have a crotchless pantyhose. And that's simply because it puts too much pressure on the vulval region, the genitalia. Lady with lipedema, side view of a patient with a lady with lipedema. And it's very easy to look from the anterior aspect to say, I'll just have leggings, so I'll keep my feet not compressed. But when you look around the ankle, there is already a pad of adipose tissue there, and we need to make sure that that is supported, because we don't want to increase any chronic edema occurring. So we would advise this lady to have an open toe garment and to go up as high as she wants it to. Fitting is very important. It doesn't take 2 seconds. You do have to make a lot of time, or sufficient time. You can't go out at 7:30 and then put your garments on at 7:28. We do have clinical advisors to instruct and support with fitting. We also have videos that you can access online of how to measure and how to don and off. So ensure that you can get it on and off. And if you have been prescribed and fitted with a healthcare professional, make sure that you take the lead and that you can do it, and you can be supported by the healthcare practitioner. But what we do advise is that you wear it, that you wash it, and you review it. Don't just put it on for an hour and say, oh, that's dreadful, bin it. Persevere with it. Again, I can only speak for Medi, but we will work with the practitioner. We will work with you to make sure that it is perfect. And again, I'm somebody that doesn't take no for an answer. If it isn't right for you, there's no point, stopping there. We need to get it right for you. We will work with you until you are 100% comfortable with it, and you can lie on your bed then and feel super supported. Factors to consider when getting compression is the type of fabric, and that will depend on the stage that you present with, how your tissues feel, how your skin feels, the strength of the garment that you need. So that's the class. So it's usually class 1, possibly class 2 or 3, but really you probably only need class 1. The style, and you can have any style that is pertinent to you. Don't be frightened to ask for colours as well. The ladies who do the blogs, who do the promotion, have different colours to suit their wardrobe. So keep up to date with fashion is something very, very important to us. Measuring and remeasuring, it is possible to purchase personally, but I really think measuring has to be accurate, and it's very, very difficult if you're not au fait with compression of actually how you measure. Medi UK have provided videos that are available on YouTube that if you are going to go down that route, that you can measure yourself. I honestly wouldn't recommend it. Your practice nurse, your GP is responsible for your health, and you should knock on their door all the time. And the practice nurse can always ask a company representative and a specialist to come and support you. Check your prescription if it is prescribed. The quickest route for getting the prescription is to go directly to the company, a prescription by post, and it's delivered directly to you, but check it. Donning and doffing is very important. Sit somewhere comfortably, allow plenty of time, don't rush. Most donning aids are available on prescription. There are some doffing aids that you can help to get garments off easily. Try not to bunch the garment up, put it on smoothly and even out the material. And just to summarize, it should never hurt or be uncomfortable. And if it is, it's either due to the measuring, so incorrect measuring or fitting, or the wrong fabric. So when you get a garment, don't, again, say no. If it isn't right for you, persevere and go back and be assertive. And somebody will always be there to fight your corner for you. Make sure it's applied without any wrinkles or creases. Get it on first thing in the morning if possible. Remove it at night again if possible as well. Consideration must be given to the most appropriate fabric, class, style, and the standard of that compression. Make sure you're taught how to get it on and off. Persevere with it. Be assertive. Work at it. It's a new skill that you have to master. But when you are in it and when it's going to be comfortable, it will elevate your life. I really hope that for you. Ask questions. It's your body. You've got to feel good about it. And certainly I'm here to support you. And I will always do my very, very best to champion the cause of ladies with lipedema and work until we know the answer and until we can get a diagnosis, a prognosis, and to rule it out and get something done about it. I get emotional when I talk about this. I don't even have lipedema, but I feel for you very, very, very much. And I really wish you all the very, very best, and I hope that we can find a solution that supports everybody. Thank you very much for listening, and if you have any questions, feel free to ask me. Thank you. You're on mute, Kate. I can't hear you.
Such a beginner's mistake. So wonderful presentation. Thank you. So are we going to bring our other panelists back in at this point, Sherry? So we can.
I think that's great to do that. I'd just like to bring up a couple of things you mentioned, Monica.
Yeah.
And obviously, you're representing one company,
Yes.
but there are many, many other
Yeah.
options there.
Yeah.
And I think that is wonderful, because there is a sort of prevailing attitude, particularly in the clinical aspect, that you find one perfect garment and that's what you get on prescription.
Mm.
But as your type of company and your specialisms bring out all these products, in my head, it's just the same as socks in somebody's wardrobe. You need different types.
Yeah, absolutely. You need different types, and you can't be limited to 2 pairs. I had a slight disagreement with a GP the other day, and I asked him how many socks he'd got in his drawer, and he said, well, umpteen. And I went, so why should you limit 2 pairs?
Yes.
It's not fair.
No, and you'd wear different colours, different styles, different weights for different.
And more that I now say as well, it is a medical device. And if you are treating somebody with diabetes, you don't go in and say, oh, we'll just have 12 units of insulin today. We'll just give you some insulin. Well, maybe we'll give you 8. No, we'll give you the required dose every day for as long as you need it. And lipedema is no different. I know it's coming onto the radar, but it is just as important as somebody who's got a diabetes or a heart-related condition or something.
Exactly. And it is, you know, we have to keep going back to quality of life.
Yes.
Your quality of life is very limited with 2 pairs of garments that you have to wear alternatively for months on end. So I do personally say to people, look at the ranges that are out there now and think about them as whether you want extra pairs or, you know, try something new, but get the fit right. And the other thing I wanted to pick up on was the role of the nurse practitioner here in the UK. And I know in other countries, maybe Margarida, with her skills and her pharmaceutical knowledge, can tell us a little bit about how it works in other countries. Because here, we're all having problems with our GP surgeries at the moment. So actually banging the door down and saying, I want to see somebody about compression, and finding the GP is pretty clueless. And maybe his nurse practitioner hasn't done many measurings, particularly of lipedema patients, or doesn't realize the significance. You do need the perseverance of the wonderful Scottish lady who I know very well and who you're talking about, to actually make sure you get that support at an accessible level wherever you are.
Yeah, and I think this is something that through the translation really of Lipoedema UK, to actually say to those who are affected, your GP is responsible. And okay, the nurse may have never measured anybody before, but every company will have somebody clinical that can support.
So let's just make this absolutely clear, because I think it's so important, as clinics are so few and far between, and some of them have a policy of not treating lipedema. So if a patient, particularly a Georgina or a Margarida, feels compression is something that will really help them, there, you know, Margarida told us how her legs ache at the end of the day. I know teachers whose legs kill them, you know, all sorts of profession, your legs do. So there is a process where you go to your GP stroke nurse practitioner and say, there is a company out there that has a clinical specialist such as yourself who will make a specific visit to my surgery.
They have to be
in this process of correct measuring.
That's right. They have to be invited in, though, so they can't just bowl up. The practice of the GP has to do the inviting. That's really important, okay, because otherwise you get the door slammed in your face. But ultimately, and it's law here, isn't it, that the GP is responsible for everybody's health. So the individual who has registered that surgery is responsible. If they don't provide a lymphedema or a lipedema service, then it is ultimately the responsibility of the GP and the practice nurse to be able to measure that person. If they don't feel competent, then they need to call somebody in who has got those skills. And I'm pretty sure, I mean, I'm only really kind of speaking from my perspective in Medi, but I do know all the other companies have got clinical advisors, and they will support people as well.
Yeah, and share your sort of the ones we deal with, share your passion
Yes.
for getting it right, which I think is really, really wonderful.
Yeah.
Margarida, do you want to just tell us a little bit how it works in Portugal? Is you're in a pharmacy, in a hospital, admittedly, but if you have a Portuguese patient, how would it work there?
So for my experience, I never tried to contact, for example, Medi, but I also work at a part-time at a pharmacy, like a local pharmacy. And the normal procedure, because here we don't like even lymphedema and lipedema, I think most of the people don't know or don't really care. They think they have swollen legs, and for the most part, a person goes to the pharmacy and they just ask for compression legs. Most of the time, they weren't seen by a doctor. They just want something to alleviate their heavy legs. So it's up to us to analyze that person. But I can tell you that my degree doesn't have the knowledge to do that. Like we don't study that. So a lot of times we end up reaching to, in our case, most of the times it's Medi, and we end up reaching to them because of the measurements, because of the person we have in front of us that we don't know what they have. And also we have something here, I don't know how to describe it properly, but we have compression legs, but we also have something that has less compression. And I can tell you that most of the old people wear it like a normal thing. It's not seen, I think here, for a large part of our population, it's not seen as a medical device. For some people, like, I can give you a practical example. When I went to a pharmacy to talk to a colleague of mine, and I said I needed compression legs, and I asked for a grau 2 because one, it's not sufficient for me when I have a 12-hour shift. They were like, "Why do you need grau 2? Like, it's so strange because most people ask for a little compression just because they have heavy legs." So I don't think we are as advanced as you are in your country, to be honest, because I think it's not something that I don't see being talked about. And when it is talked about, it's always, from what I've seen, from a commercial perspective, not just a health perspective, I think. And I think
the most relevant point of what you've just said is I was not taught about it during my degree, and here I am, a qualified pharmacist.
Yeah.
But yeah, which is marvelous. Kate, I'm going to hand over to you now with your questions for the panel.
Thanks. Thank you, Sherry. So we've got a lot of different questions. One of the first questions we had sent to us in advance of the webinar was for Georgina and Margarida, asking a bit about what impact has being part of a patient association or a charity had on your lives, and how does it help? Because that's something that for some people, particularly some of the younger people who, as you referred to in your presentations, can have very different experiences to some of our older members. So it'd be really great to hear why you think an association, what are the pros and cons of being part of one? How has it helped you? And what else could we do as associations to really help women in your situation? So which one of you'd like to go first in answering that?
I'm happy.
Georgina, looks at you.
I've got a couple of points. So I think one of the things is it's really helped me with the process of coming to terms that I've got a condition at my age, and especially when I was younger as well, because you think, oh my goodness, what is to come? And it's really daunting, and you have all these ideas in your head, what's my life destined to be like? Are my legs just going to get bigger and bigger? What is going to happen? And I think it's really helped me to accept it, because I can see the work that's being done to better the outcome and the lives our daily lives with lipedema. I'm aware of like companies such as Medi who work to make our lives better and ease our pains and address our daily problems. And it's just that part of being a community, and being a part of a group, regardless of whether there were younger people when I first started working with Lipoedema UK, regardless of all that or not, it's that like sense of we are all together in this and we all share this, whatever it is that gives us this condition. It's just brilliant to know that you're not on your own. That support. For me, that's my thought.
Thank you. Margarida, what do you think? What would you?
Yeah, I feel the same way. It was actually very, very good for me to get in touch with the association. And not only do I get support, I actually got a lot more because through the association and by talking to Manuela, I discovered a doctor that I went to see after, and that it's with me until today, and he's the one who gives me advice about my disease, and I got to know him only through the association. And also the association allows me to have a discount in my drainage sections in a clinic. So all of this has helped me tremendously, like with practical things that help me day to day, because it's like that. It's there every day, and the fact that I found a doctor and I found a clinic that can really help me through the association has meant a lot to me, and it means a lot to me also to be able to have a platform where I can talk about this issue.
That's wonderful. Thank you so much. And I think it's really good for people to hear. I have to say, Monica, I am so excited that you have a background in tissue viability and wound care, because one of the things that we know for some of our other members is that that's an environment where people are really close to your legs, examining your legs, and it's a really powerful community to bring about recognition of diagnosis. And sister associations to us in the tissue viability world have been great partners with us. So your background is very exciting. I have some quick fire questions for you, if you can, because as you can imagine, there's a lot. So firstly, you said you don't recommend compression garments that cover the panty section but have an opening
Crotch.
in the crotch because you are concerned about the vulval pressure. We've had some questions about, but what about post-surgery? Does Medi recommend these garments for post-surgery? Because not having an opening to urinate through can be difficult for people who are concerned about removing the garment enough to use the toilet. Yeah. What are your thoughts?
You can have crotchless. It's just that I wouldn't recommend it. Mm-hmm. That's my perspective from having seen severe pressure damage from them. But again, that may well be down to how you measure and how you fit and the fabric. So it is possible. Any style is possible. It's just that I wouldn't recommend them, but you can do it. That aspect of it is not available on the prescription route.
Perfect, thank you.
But it doesn't cost very much. Doesn't cost very much.
Perfect. So maybe it's something for people to think about for perhaps a post-surgery experience, but maybe to try garments with a closed crotch for normal, longer-term wear.
Yeah.
Perfect. Laundering your compression. Could you talk a little bit about what tips Medi has? Some companies sell like a laundry solution for compression. Does Medi have any particular recommendations around how to wash the garment, machine, by hand, with what soap?
Yeah. All the garments come within washing instructions on them anyway in the packet, but you can wash all our garments at 40 degrees centigrade, and you can tumble dry them. You can also hand wash them if you want. The only thing that we also recommend that you turn the garments inside out to get rid of any skin scales and like that, which is quite normal. We often do that, don't we? The only thing that we don't recommend is to put softener in it, fabric softener, because it blocks the climber comfort. So the climber comfort allows the garment to breathe, basically.
Okay. Biological versus non-biological laundry products, does that make a difference?
No.
Or any other laundry advice?
No. Okay. No. As far as I know.
Yep.
never really been asked that question before, but it will be on the instructions. So read the instructions.
Perfect. So you said Medi's garments can be tumble dried.
Yeah.
Would you recommend tumble drying them only occasionally if someone's in a hurry, or do you think that does Medi feel generally that garments can be tumble dried?
It doesn't matter. I think you can tumble dry them all the time as long as it's on a cool setting. So 30 degrees. Yeah.
Perfect. Okay. So one of the tips that we often share in our community for people who are using a washing machine to wash their hosiery is to put it in the net bags that you can buy at a supermarket or something.
Yeah.
So the garments are perhaps, particularly if they're washed with other items, they're not tangled in your other laundry.
Yeah, definitely I'd recommend that as well. Yeah.
Perfect. Excellent. Okay. So our next question is something that you covered in your presentation when you were showing us your garments was about like wearing different styles and the bringing together different garments like thigh highs with shorts and so on. Where somebody has an all-in-one, like a pair of tights, we call them in the UK, pantyhose for our American sisters and other people. Some people with lipedema prefer that the compression goes up over the thighs, and a traditional lymphedema hosiery will often have the compression reducing significantly at that panty section. So you get that line just where the buttocks and the thighs meet. Is that something that you've had a lot of feedback about? Is that something your lipedema specific line addresses by taking compression up over the hips?
Whenever I've done compression hosiery for ladies with lipedema, I've always advocated that they should have tights. And because our garments are knitted in a 3D aspect, you will always get a seam around the buttocks and through the crotch and up the side. So it's all knitted together in that 3D aspect. Does that answer your question?
I think so. It's people's opinions about what they find comfortable. And certainly for people who want compression for exercising, often having with lipedema a reasonable degree of compression over the hips and thighs, because you have this big bulging thigh. One of the things you talked about was about support and that desire for support, not just encouragement of venous and lymphatic return. I think why people feel they get more comfort out of being gently pressed.
So there are different standards of compression, and there are different classes of compression. So you can have, in our garments, you can have a class 2 RAL up to your thigh, and then class forget that. Talking with a different hat on.
People can talk about their different requirements, can't they, for where they want more and less support, and that can be worked in.
And also, again, that's down to the measuring as well. So if you want a garment that is very, very secure, then you pull the measure tightly, and if you don't, then you relax it. So it gives you a bit more give.
Perfect. So I have a quick question. Can you just talk about the difference between Mediven Mondi and Mediven Cozy again? Someone on YouTube wasn't sure what the difference was.
Yeah, they're both flat knit fabrics. Mediven Cozy is specifically designed for ladies with lipedema because it's got a greater stretch to it, so it's easier to pull it on, and it's a more flexible garment. But it's a bit of a kind of Peter Pan thing, really, I think, with a bit of pixie dust on it, because it's got very firm feel to it. It's got very firm properties, but it's very, very soft to wear, I think. It's got greater flexibility. Mediven Mondi is a garment designed specifically for a lymphedema and lower stages of lymphedema. So it's a much, much lighter fabric. Again, I mean, it's still appropriate for people with lipedema as well. And again, you can be guided by your healthcare practitioner or seek advice from other people who might have got a Mondi and a Cozy.
Perfect. And lastly, Monica, we've had a lot of people talking in our various YouTubes and Facebook streams about challenges with prescriptions. So could you just repeat again for them your understanding of what, for UK patients, the National Health Service ought to provide around the number of garments they are reasonably entitled to, for what period, how many months before they would reasonably be offered a replacement, and how many?
Okay, I can only speak for Medi UK at this point.
From
Okay,
your experience.
Medi's fabrics will last for 6 months of daily wear. So, 7 days a week, 6 months. So the NHS, because they're always crippled and the garments are expensive, they are available to be prescribed. But I would always say you need the minimum of 3 garments. So a washer wear and a Sunday best. So you've got one to wash, one drying, and one in the wardrobe for the next thing. So I would always start with a color that comes quickly. So sand, cashmere, black, navy, something that will come quickly from the manufacturer, because in Medi we try to be environmentally aware, so we only fill the washing machines with the specific dye once a week. So if you wanted something like magenta on a Wednesday, the dyeing day for that might be a Tuesday, so the extended time it takes to actually get that garment dyed, because they dye them all at the same time and then they discharge it into a watercourse and it doesn't pollute the environment. So yeah, I think colours are very, very fashionable. We've gone away from hopefully the granny tights being, American tan. Nobody wears that anymore. We need to strive out and make a picture. I often attend lymphatics, which is a lymphedema occasion for youngsters to come to, and they bowl up in their bright greens and their bright pinks and everything, and they have a very bold statement to say. And I think it's testament to both of you two lovely ladies that, well, all of you 4 on screen at the moment, that you have a fashion statement to say. You need to be heard as well, really.
That's super. Thank you. You've been amazing, Monica. And we've got lots of feedback for Georgina and Margarida from people saying how wonderful it's been to hear your stories, how inspiring you are. Some other people who've got younger women in their family. So I'm sure you both would encourage them to follow you on socials, to follow our organisations of andLINFA in Portugal, Lio in Italy, and Lipoedema UK. And if they reach out to all of us, we can encourage them to be part of that real legacy network, can't we, Georgina? Internationally, not just within our own countries. So if you're watching this live or on catch up, and you have someone in your family who is younger or early stage and wants to tackle that loneliness that Margarida talked very much about, and Georgina, please reach out to all of us through our socials and join that network, because as we say in Lipoedema UK, together we can beat lipedema. We have, if any of you would like to take one moment and give us one final comment or tip, you're very welcome. Georgina, is there anything you'd like to just say as a last word?
On the spot there, I just want to say it's been brilliant to be a part of this evening, to hear stories, to see what Medi are doing. It's just great to be a part of, to see that change happening, and to feel that hope and that collaboration for the future. Like, it's so exciting. That's it. I feel really excited. So
Okay, thank you. Anything from you, Margarida, before we close?
I just really want to thank for this opportunity, because it really feels like I already felt like I wasn't alone, but now it's a bigger scale. And meeting you, Georgina, was just amazing, because it's like it's the same thing, it's the same story, and gives us hope for being diagnosed sooner and do things sooner. It's awesome. Thank you.
Thank you. Monica, any last words from you before we close?
I would say never give up, never accept no, and keep going back and knocking on the door until somebody finally answers it, because they will, because they'll get fed up of you.
Perfect. Well, it's the partnership with people like yourself that makes it possible. And when Shari talked earlier about having been in this for 10 years, the work that people like she have done to get us here is really powerful. So as always, massive thanks to Shari, to Valeria, and Marcella from Lio, to Manuela from andLINFA, and everyone else who's got us here. I would like to remind you that we have more webinars coming up. So on the 1st of July, we have Dr. Simaro from Spain talking about other conditions associated with lipedema. On the 6th of July, we have Dr. Mia Vollrath from the Hansa Clinic in Germany, where Georgina went, talking about lipedema surgery in earlier stages. On the 12th of July, we have the intermediate and advanced stages lipedema surgery from Dr. Burgos de la Obra from Spain. And then lastly, on the 20th of July, we will have Dr. Michelini talking about future plans and kind of association work and so on. So I hope you can join us again. Thank you very much to all our speakers. Shari, is there anything else you'd like to say?
Yeah, I'm on Andres. I
You
have
are.
one thing to say,
Go.
which can actually be cut off the final video version, which is we sent out an email today with the link for this, and we said that lipedema was going to be featured on embarrassing bodies. We copied it from the surgeon, Dr. Gupta, and it said it was on channel 4 at 10 o'clock tonight. We've actually been in touch with the producers, and it's on channel E4. So a lot of people have been sending us messages saying, oh, it's another program on channel 4. So for anybody who's confused, Embarrassing Bodies is going to be featuring lipedema this evening and some of our patient photos on E4 at 10 o'clock. But apart from that, I really want to say thank you to all our amazing presenters for your skillful presentations, that you've covered so many aspects. And again, I hope that this will give so much enthusiasm and reassurance to people of your own age, but also your parents and people who really care about you, because I know there's nothing worse than a parent seeing the beginning of lipedema and feeling hopeless and feeling they don't know what to advise for their most precious person. So again, I hope parents will take a lot from this. And of course, we have to say, if you support our organizations and our collaboration, we will make a difference and we will move it forward. And we do need membership, we do need support, we do need a communal voice. And thank you to all the associations that are taking part this evening. So we're Lipoedema UK are very, very pleased to collaborate with you all. Thank you. And thank you, Kate, for doing the questions and fantastic presentations.
Yes. See you all in a few days, everybody. Stay
Yeah.
safe and see you soon. Thank you so much.
Bye, everybody.
Bye.
Bye.